think we're good. We've got some presentations today in lab. Get those started. We are also dissecting night crawlers. They are garlic flavored. Don't know why. They are. We're going to look through them. I hope that doesn't change anything. This is the first time I've seen garlic flavor. But we'll look for monocystis. We'll do that in lab. We'll also look at the Gregrins. Friday, no class. It'll be your time to kind of review life cycles and everything. Any questions? We only have a couple weeks left, right? Next week, Friday is our exam. That'll go through our protozoans. So start studying, start reviewing. It's quite a bit of information. All right, so this is where we left off. I married Tenella. I did the life cycle up on the board. Big life cycle. It is, they go into the gut mucosa, right? Lamina propria, they get picked up by our macrophages, transport us to these crypts of labor pune, where now they get released and they infect epithelial cells. So these are cells, crypts, they will get in there, they will destroy them, and that every time they cause this cell death, you're going to have pathology associated with it. So this is not a good one to have. All right, so epithelium of the intestinal ceca of chicken has a potential for infecting the entire chicken coop and often causes death of young chickens, and that's a concern. Once it gets in there, it normally infects all the chickens, and the young chickens end up dying. So there's really no treatment for it. It happens pretty quickly, as we said, with the number of days. It was about 6 days or so from when they first get infected to when they start shedding oocyst. And by the time they start shedding oocyst, if they're shedding oocyst, they normally survive. So a lot of the death happens earlier on, which is 2, 3, 4 days. That's it. All right, but there is some hope for the chickens. So we do have prophylaxis, and these are coccidiostats, which are anti-coccidial drugs. Oftentimes these are included in commercial feed, and it's feed specific for the young chickens. So what they're trying to do is prevent the infection from ever taking hold in that coop. There is some vaccine research, but they've shown mixed success. And it's really for just a couple different reasons. Number one is the cost associated to produce it and then administer it. All right, this isn't a vaccine where you can just dose it into the food and then let the chickens self-vaccinate. You have to pick up every single chick and vaccinate them to try to protect them. So that's going to be a cost. You're going to pay someone to do that. Also, the effectiveness is based on the species and strain of Eimeria. So Eimeria tenella is the species, but there's your subspecies, or I should say the strains, that show different abilities to escape the vaccine protection. I mean, anytime we start dealing with these protozoans, it's going to be difficult to develop a vaccine for them. They're so good at evading the host immune system to begin with. That it's kind of hard to hope that vaccines will solve our problem. Breed of chicken can also have an effect. So white leghorns might respond differently than your egg layers. So you can see there just several different factors that limit vaccine. This is an inflamed ceca. Inflamed intestinal ceca. So that is what Eimeria would look like, and you can get clogging and ultimate death. So ready? All right. So these are key points with the life cycle and deals with our pathology. So as we said on the life cycle, I highlighted each of those steps where we have cell death. Each of those rupture events can lead to pathology, or at least they all contribute to the pathology that we observe. So generically, infection by a coccidian parasite would be coccidiosis. All right, that's a generic term because anytime you're having this rupturing of the epithelial cells, you get some of these same types of symptoms. All right, so what is it? What are the symptoms? Bloody diarrhea. Right, you're damaging cells, you get a slight hemorrhage, and when you have a large number of cells all get ruptured at about the same time, you can start seeing blood in the stools. Host tissue disruption. So basically, you're disrupting the ability of the intestine to do its job. Since you're having a hemorrhages, you can have a possibility of secondary infection. However, usually there's not enough time. Usually the chicken's going to die before a secondary infection can take hold. However, if you do have a chicken that gets to the oocyst stage and is shedding oocyst, they may need treatment for a secondary infection. They may need some antibiotics. All right. You'll see sloughing of the epithelium that kind of leads to your host tissue disruption and your bloody diarrhea. You can have tissue necrosis from clogging of the cecum. So you're having some of the hemorrhage, you're having sloughing of the epithelium in the cecum. That's a dead-end sac. That's what it is. And that stuff isn't going to get out. It clogs, and then since it's just stagnant there, it can lead to death of that tissue in the cecum. All right, and all of these things leads to a very high probability of death in our chickens. Also, with our life cycle, second to kind of finish off these symptoms. So these would all be symptoms of your coccidiosis. All right, so our infections are self-limiting. So most of that third generation of the merozoites will undergo gametogeny. And that means once they do that, they're not going back to replicate. They transition to the gametes, the gametocytes, micro and macro gametocytes. Right. That proportion, that small proportion of the third generation that continues to undergo merogeny is going to be controlled by those macrophages. So it starts to limit the pathology, and the macrophages start to clear them out. So every time it gets ruptured, macrophages take them up, and then they don't reinfect. So you're getting fewer and fewer cells with each generation. Fewer and fewer cells that are infected with each generation. And as we said, if the chicken survives through oocyst release, then it usually recovers. Problem though is once you get it in the coop, you're normally killing off all the chickens, and then you're left with the difficulty of sanitizing and sterilizing the coop. So those oocysts are extremely resistant. They've got that double layer, remember? All right, bleach is ineffective, and really what some of the places have done is brought in blowtorches, basically heat sterilized the entire thing, which if you're dealing with a wooden barn, it's pretty dangerous, right? Metal buildings, metal coops, you might be able to do something. They do gas disinfection as well. But again, it's tough to remove. Ready? This is one that you don't want in your chicken house. All right, let's move on. So the next one is Toxoplasma Gondii. This parasite is in the family Sarcocystidae. And these are actually the parasites up here. These banana-shaped parasites. This is off of a slide. This is oil immersion. Notice you can't really see a whole lot, but we can identify that I believe this is the anterior end up here, whichever side has the more darkly staining structures. All right, so members of this family have a heteroxidous life cycle. So far, we've only had basically a one-host life cycle, monoxidous. Members of this family have usually a two-host life cycle. So you have your asexual reproduction, asexual development. I should say asexual development occurs in the vertebrate intermediate host. If we were going to break it down to intermediate versus definitive, right? So just your asexual stages happening in the vertebrate, and usually it's going to occur in various tissues. And then other vertebrates, potentially carnivorous mammals and birds, are the definitive hosts. And when you have your sexual reproduction, so your gametes forming and zygote formation, that's usually going to take place in your GI tract. All right, so you can kind of see you're in various tissues, and then you're going to probably need some sort of predator to consume that individual to get to the GI tract so that the life cycles can then enter that sexual reproduction phase. The example life cycle that we talk about here is Toxoplasma Gondii. So this is going to really showcase this type of pattern, life cycle pattern. The Toxoplasma Gondii, cosmopolitan parasite in humans. It's all over. It's all over. It is all over. Is it here? Oh yeah, it's here. Here in San Diego. Definitive hosts for us are felines. What does that mean? Definitive versus intermediate hosts. That's going to be our host where we have the sexual stages inside the GI tract. So cats are going to be the host where they replicate and will start to release our oocysts. Intermediate hosts, all of hosts where you're going to have infection in the various tissues will be felines and other vertebrates. So other vertebrates would be humans, rodents, cattle, birds, etc. A lot of organisms that can be infected. Notice, felines occur both places. This is one of those parasites where you can have the feline get infected and have this sexual reproduction in the GI tract, and then that parasite goes into the tissue, and now our feline will start to serve as one of these intermediate hosts. We saw another life cycle where it was kind of like that, where you had the host, same host as an intermediate and a definitive host. Which parasite was that? Anybody?
Was the frog?
No, I don't think we had one of those. Well, yeah. Do you remember what kind of life, what parasite that was? We talked about that was the Spitibacterium, I believe. Is that right? Went into the tadpole and then it migrated. Oh, the monogene. There we go. It wasn't the monogene. Polystoma integerum. That was. So it's in the bladder, and it initially gets infected with the tadpole, and then it moves out of the tadpole, crawls across the body in that span of a minute. Okay, that could work. Didn't consider that. That's not what I was thinking of. What nematode would do this? Also pretty cosmopolitan. Anyway. Had a final exam coming up. I'm going to start writing down all the species that we have. Trichinella, Boralis. Get it? Eat that nurse cell. J1s penetrate, get into the gut. They're in the gut mucosa, right? Become adults. They replicate and then they release J1s. J1s then travel through the body to the muscles. So, Toxoplasma Gondii, Trichinella, and polystoma. All right, so in this life cycle, the replication stages that we see includes merogeny, endodiogeny, and endopolyogeny. We'll talk about those. So those are those three terms. Well, we've already covered merogeny, production of merozoites, but we didn't talk about endodiogeny and endopolyogeny. Ready? All right, merogeny. That's production of merozoites via multiple fission. Budding takes place at the plasma membrane. All right, so you have your schizogony, basically. That's your merogeny part. So you can see that you have your replication, you've got your multiple fission event, and then all of a sudden you have your pinching into the plasma membrane to produce all of these different daughter cells. So that's our merogeny. All right. Endodiogeny, that's depicted down here, is the production of two daughter cells that bud internally, and plasma formation then occurs inside of the cytoplasm itself. So you've got this stage where each individual is going to duplicate, and then they are going to bud, and you will get your cytokinesis so that inside of it, so here you had your plasma membrane starting to pinch in. Here it does not. You've replicated, you have your actual cytoplasm formation, plasma membrane formation happening internally. Endodiogeny. Oh, that was endopolyogeny. This right here, daughter cells here. So your one, this is probably good. Here's your, you could say your merozoite. You've got your nucleus dividing, and you have membrane formation already occurring. You have your apical complex forming. You now have your two endoplasmic membranes continue. So then when this thing breaks, you've got two of those. That's your endodiogeny. The endopolyogeny, that's you get more than two daughter cells. That's the wrong one. So more than two daughter cells that bud internally. Again, plasma formation occurs inside the cytoplasm. So that's a big difference. Your merogeny, schizogony, that's what we've been seeing. That's what we'll see again in our plasmodium. Right, so outside pinches in, kind of feels in, and you got a bunch of daughter cells that end up emerging. Endodiogeny, two. Membrane formation occurs inside of that cytoplasm, so it's not the external membrane that pinches in. And then the polyogeny, endopolyogeny, is more than two. Di, two, poly, more. We'll see both. We'll see both of them on our life cycle. Ready? All right. Hope I gave you enough room for the life cycle. Enlarge this. I gave you enough room for the life cycle. All right. As a preview, here's our life cycle. We'll start with one. All right. And the reason we have this is because of the cat, that feline. All right, so the feline is going to have the replication occurring in the GI tract, but then you have the separate cycle that can occur in tissues. All right, so you've got, if we ingest the parasite, we've got one type of pattern that we're going to exhibit. And the cats, they're going to exhibit both patterns. So what we're going to start is basically with our feline part. All right, so we have our oocyst here. All right, this is our sporulated oocyst. So just like Eimeria, inside of our oocyst, we will have 2 sporocysts. Each of them will have 4 sporozoites. So that's our infective stage. And then our cat is going to go ahead and consume this. All right, the cat's going to go ahead and consume it. So that's going to release our sporozoites inside of our small intestine. And then these sporozoites are going to penetrate into the epithelial cells. All right, so they're going to penetrate, and you'll basically have your trophozoites, and then they become your meronts that then undergo the merogony. And just to kind of simplify it, we're going to say it's going to penetrate. You're going to get to the meront stage. This is in our intestinal epithelium. All right. And these guys will undergo the merogony to produce the merozoites, which then rupture and release. And then reinfect other intestinal epithelial cells. So you'll get your amplification that takes place. Some of these have your meront. Yeah, I'm going to keep it as meront, because that's what the life cycle says. Some of them are in the GI tract. When they infect the cell, they will differentiate. All right, so some of them will reinfect and then continue the cycle of merogony, producing more. Others will penetrate the gut epithelium cell, and then they will undergo your transformation. Basically your gametogony. Actually transform. So we'll have our macro gametocyte and your micro gametocyte. All right, and then you undergo your gametogony to produce your microgametes. And these will get released and penetrate the cells that have that macrogametocyte in it. So much the same way as Eimeria and so forth. So you'll have your zygote then inside a cell of the gut epithelium. You will have your cyst wall formation. And then release into the gut. So now we have an immature oocyst. So that is in our GI tract. This gets released in the feces. Environment. occurring inside of our feline. So we need, in the presence of oxygen, we will then have our sporulation event. That produces our mature oocyst. Questions?
What does that say under oxygen required? Is it separation?
Sporulation. Sporulation. Because we're going to form our sporocytes and sporocysts. So that's going to be our genetic reduction step. So we've doubled. We're going to have our genetic reduction step at that point. But it needs oxygen. All right. About halfway done. Some of these merons in our cats will escape the GI tract. They will penetrate the cells and then get to various places. So normally we're in the gut epithelial cells, those cells that are closer to the lumen, but we can penetrate, get into the lamina propria, the mesenteric lymph nodes, travel to other organs, and it includes some of our white blood cells. And once we do that, we are entering into a different cycle. At that point, we are entering in the extraintestinal cycle. And that means then, this cycle that we just described is called the enteroepithelial cycle. So enteroepithelial cycle is your intestinal epithelial tissue. All right. So once we get to that, where are we going to go here? We get to I think we'll just get to another one. So I'm going to introduce some other terms. You're going to see them in the life cycle. All right. So once we get to this, they penetrate out of the gut. And they are tachyzoids, infecting these various tissues. And I've got them on the slide, and the tachyzoids just mean they're fast dividing. Tachy, like a tachyometer, is measures like RPMs, how fast it cycles. So the tachyzoids are these fast replicating. These things are going to be inside cells, inside of parasitophorous vacuoles. All right. And in these tachyzoids that are replicating, they're going to replicate and they're going to cause the cell to rupture. So release and reinfect. And at this point, they are replicating here via endodiogeny. So we had our morogony happening inside the gut. But once we get outside of the gut, now our tachyzoids are replicating via endodiogeny. So we're in that parasitophorous vacuum. All right, so this is where this will go. So these meronts escape, they get into other cells, including white blood cells, they get internalized, they become tachyzoids, and then they start dividing via endodiogeny. All right, and then from here, these tachyzoids are going to get, since you have the release and reinfect, so now we have our tachyzoids. We're in our blood and tissue fluid. All right. So some of these and will travel where they will now penetrate other tissues. We're going to specify brain, heart, skeletal muscle. It's for reasons. These, once we get into these different organs, then you start seeing more of the pathology associated with toxoplasmosis. But once we get into there, these tachyzoids transition to something called bradyzoids. And I also have this definition on there. So these tachyzoids are fast replicators. These bradyzoids are slow replicators. So the bradyzoids are going to replicate very slowly, and then what they will do is they will start to lay down a cyst wall, forming what is called a zoedocyst. And this will enlarge until it ruptures. Releasing bradyzoids into blood and tissue fluid, which will then reinfect these organs. This part here, this cycle, zoedocyst, rupturing, will boost immunity. Because what we'll see is once we get these toxoplasma, we start to become immune, especially the cats. They go through a cycle, they're going to shed oocysts for a couple weeks, and then that's about it. They're going to have this stage, they're going to have these zoedocysts in their tissues, and every time they rupture, it's almost like a vaccine booster. So if they infect or consume some other stage, you're not going to see these oocysts. Now that means then, inside of our cats, and this is our hosts, this will be our host, so our cats and other mammalian hosts, but we didn't really talk about how these other hosts become infected. Well, they can be infected in several ways. We can have mature oocysts. All right? All right. You can get your sporozoites in the gut then, once they get consumed. Do this. So we're going to mark this. We consume mature oocysts. That releases the sporozoites in the gut. And in these organisms, you will get penetration to sites outside of the gut. So we can consume mature oocysts, or we can consume tachyzoids which gives the tachyzoids in the gut, which also penetrate to sites outside of the gut. And our last one, you can ingest a zoetocyst, which gives us our bradyzoites in the gut, and these penetrate out of the gut to tissues outside of the gut. The same thing can happen in the cats. And same type of deal. So again, I just kind of skipped this sporozoites. You're basically your tachyzoids or bradyzoites at this point would penetrate out of the gut, or they'll stay in here, they'll infect the intestinal epithelial cells, they'll transition to those merons. This line is the least effective. So you got to think, you've got the tachyzoids in, let's say, blood cells, white blood cells. So we'll say macrophages. All right. Cat ingests that. These tachyzoids are the most sensitive to stomach acids. So that's why you ingest tachyzoids, less chance of actually getting infected. The zoetocysts, they consume the zoetocysts, probably a likely scenario. They have a cyst wall. That's going to allow them to survive, so then the bradyzoids can escape, penetrate these intestinal epithelial cells, and so forth. So where do they infect it? Well, the cats, they can consume a rodent. All right, and they get it that way. What about humans? Undercooked meat, especially if that meat has toxoplasma. Normally you're dealing with wild animals at that point. But important pathway are these oocysts. Accidentally ingesting oocysts. These oocysts are resistant to the environment. You're out gardening, cats can use your garden as a litter box. They're releasing the oocysts. All these damn cats around campus, yeah, I could guarantee you that they have all had toxoplasma. Some of them may be shedding oocysts. Don't go out there, work with your bare hand, and then eat without washing your hands. You can ingest the oocysts. Cleaning litter boxes, great place to get it. Questions? So, this is our extraintestinal cycle. That's our enteroepithelial cycle. Our cats exhibit both. All other mammals will only exhibit this extraintestinal cycle. So cats are the only ones that will release our oocyst. All right. All right, so key points of our life cycle. We have the enteroepithelial cycle, and we have the extraintestinal cycle. So in the enteroepithelial cycle, replication takes place entirely in the epithelial tissue, epithelial cells. This is going to occur in feline hosts. And it's a rather interesting story. Here's an oocyst. Oocyst, 2 spore cysts. They're going to have 4 sporozoites inside of them. So if the cat ingests an oocyst, they're going to release oocysts only about 30% of the time. So some of them will just penetrate right into the tissue and that's it. If the cat ingests these bradyzoites or zooidocysts, so zooidocysts that have those bradyzoites, oocysts are always going to be shed. Catch though is if they're immune. You always have that possibility. So I think what some of the literature suggests is that they can shed maybe 2 or 3 times or shed for a couple weeks and then they develop immunity to it. And then they stop shedding. The extraintestinal cycle is when we have our replication in tissue other than that intestinal epithelium. Here we see the Tachyzoids. These are the fast dividing schizonts. And remember, the schizonts are just a generic term for that life cycle stages that replicate. The bradyzoids, these are going to be our slow dividing schizonts. And the bradyzoids are going to ultimately form these zooidocysts. So it's a tissue cyst consisting of a cell with a large number of bradyzoites that are encapsulated in a tissue wall or a cyst wall. So here's one. We have some cross sections of tissue so that we can see these zooidocysts. So this is a congregation of bradyzoids. I think this is liver tissue. So there's our zooidocyst. You got to remember, it's going to probably be more circular. So we're just catching a slice. So some of these we have on like a longitudinal axis. Some of them are more kind of on a longitudinal transverse axis. Here's another one. These are not zooidocysts. Those are part of your liver. But we can see some of those. So the enteroepithelial, always in cats, extraintestinal, cats, and our other intermediate hosts, so our other mammalian hosts, including humans. Ready? A lot of information. All right, pathology. So if you have toxoplasma and you exhibit symptoms, it's called toxoplasmosis. Most of the infections in humans are going to be mild or asymptomatic. And you probably wouldn't have recognized it as a toxoplasma infection. When you do exhibit these symptoms, the acute symptoms, it looks more like the flu. All right, so you have painful or swollen lymph nodes, you have fever, anemia, muscle aches, headaches. I mean, these are all things where your immune system's responding. You've got these tachyzoids replicating, your body's fighting them. Again, typical. Again, basically the symptoms of flu. The only exception is when you have flu, you have rapid onset of fever. That fever comes on usually in 12 hours. You go from feeling, you're feeling just fine, and then all of a sudden, you're just out for the count with a high fever. That's a flu. You don't get this with toxoplasmosis. And usually that resolves itself. Right? Your body takes it out. Takes out the tachyzoids. So the tachyzoids are the fast replicators. They're replicating, the bursting cells are reinfecting. So your body's constantly being hit by these antigens, once they start clearing it out, or once those tachyzoids start to transition to the bradyzoids, you start limiting the number of these cells that are actually in the blood and tissue fluid. So once you limit that, then your body's not going to respond strongly at all. All right, so one of those ways in which we could evade the host immune system is to be inside a cell. That's what they are. These bradyzoids inside the cell, your body's not seeing it. All right, but just because they go transition to a bradyzoids doesn't mean we're in the clear. All right, and this is the chronic infections. So the pathology associated with the chronic infection just really depends on the location of these zoetis cysts. So the formation of these cysts, because when those things rupture, you're going to get a very intense inflammatory response. And just like our pseudocysts from Trypanosoma cruzi, when you have this very heightened immune response, intense immune response, a localized response, you can get necrosis of surrounding tissue. So that's why we said when this happens, the pathology just kind of depends on where that zoetis cyst is. So if it's in the brain, then what you'll typically start to exhibit is chronic encephalitis. So chronic inflammation in the brain with spastic paralysis, because you're disrupting nerve functions. These bradyzoids can travel to the eye, specifically to the retinal cells. And again, they rupture one cell, and then this inflammation causes necrosis of surrounding cells. You damage your retina, you're going to get blind spots and ultimately blindness if not cleared. This is called ocular toxoplasmosis. Since it has its name, it kind of gives you an idea that this is something that's been seen. I mean, it's not super common, but of the toxoplasmosis cases, you can get it. You can see it. Then if it goes to the heart, of course, you can have heart damage, just like you have Trypanosoma cruzi. All right. We'll finish this up on Wednesday, and we will start the malaria section. All right. I do think we'll finish the malaria probably on Monday. So that last presentation, malaria or plasmodium, that'll be the end of our exam 3. All right. All right. See you in lab. I'm prepared to dissect a nightcrawler.